Hello, and welcome everyone to a special podcast interview for the Polio Survivors Fund this morning. Today, we're very fortunate to speak with Professor David Heymann. Professor Heymann is infectious disease epidemiology professor at the London School of Hygiene and Tropical Medicine, and before that also worked for many years at WHO as a leading infectious disease expert and also in charge of polio. Dr. Heymann, thank you so much for being with us today and speaking with us. You've spent your life fighting infectious diseases, including polio. What is your view of something like the Polio Survivors Fund, which we're talking about today?
Well, you know, Oliver, one of the last persons with polio that I saw was a person in India, a child who had not been vaccinated because his parents were poorly informed about the benefits coming from that vaccine. This child was paralyzed, a young girl, and it really troubled me to see in a country where polio eradication was almost completed, the children were still being paralyzed by polio and would be paralyzed for life. And that image has stuck with me since then, a mother carrying her child who was not able to walk because of polio, because the mother didn't understand the importance of vaccination.
And a disease such as polio, what does it do to, what are the effects to the child and the family as well?
Well, you know, polio, it causes a double burden. It causes a burden on the person who's been infected, who's paralyzed for life. And that person will have to fend for their life in the best way they can. And many hopes are that this will be contributed to by groups such as the fund that you've set up, Oliver, so that they can have a good life in front of them. But the other burden is on their family that must take care of them and must assume responsibility for them, possibly throughout their whole life. So it's a very tragic event when a child becomes paralyzed by polio and becomes a burden not only on themselves, but on their families.
Where, of course, there's a global effort to try to eradicate polio. The world is very close, but there are still some infections, still children in remote areas being affected by the disease without access to health services. Are there things that can be done for such children and their families that this fund could be looking at?
Well, you know, I lived for several years in Malawi, where I worked for the Center for Disease Control. And during that period of time, I became very aware of NGOs, local NGOs, that were doing wonderful things for children who had been paralyzed. They were at the same time attempting to continue their funding sources, but as polio disappeared, there was a feeling that, oh, it's no longer necessary to contribute to these groups because polio will disappear. But that's not the case. Polio, which has paralyzed children, remains with them for life, the polio paralysis, and so they must have support throughout life. And those NGOs were struggling then, this was back in the 1980s, and I'm sure they're struggling even more now to keep up the excellent service that they provide to people who have been paralyzed by polio.
So by tapping into these existing networks, this can help ensure, because they have the contact on the ground to the children and to the families, so they would know exactly what is needed for the families and what can be provided.
Absolutely. This NGO in Malawi, for example, Malawi Against Polio, was just one of many NGOs that exist in countries around the world. And they really need support to continue their work because they know the local community, they know the people who need help, and they know how to help them.
Thank you so much, Dr. Heymann, for speaking with us today. Maybe do you have any final reflections for our audience today?
I think that we need to continue to remember that polio is a disease that's being eradicated, but the detrimental effects of polio in children who weren't vaccinated are extremely important as we move forward to make sure that they can live a normal life and not become a burden both on themselves and on their families.
Thank you so much. And of course, thank you to our audience for joining us today and for watching this podcast. Please do stay in touch with us, stay engaged with us, become involved, become a polio eradicator, as we like to call it in this community. Support us, volunteer for us, and in any event, stay in touch with us. Thank you so much, David, and thank you to our audience. Have a wonderful day, everyone.